Hello friends, welcome back to my YouTube channel. Today we are going to discuss about the morphology of permanent maxillary lateral incisors. Okay, so like last previous video we have seen the maxillary central incisors. So today we'll see around maxillary lateral incisors. What will be the morphology of this tooth? Okay, let's begin this journey. Okay, so basically, maxillary lateral incisors is the second tooth from the midline in each maxillary quadrant. Okay, this is the second tooth. Okay, of the front side. Okay, so it resembles similar like a central incisors, but in a smaller way and more rounded and show great variation in forms. Okay, so what are the general features of this tooth is as I told you, it is the second tooth. It will be the smaller and narrower than maxillary central incisors. Okay, so greatest variation in form after third molar. Okay, like what are like changes in a sense you can see peg shape, sometimes dense investigation. Then main function of this tooth is cutting tooth. Okay, food. Okay, so mainly it provide for the cutting the food, sorry. Then aesthetic purpose also it is useful. Okay, so how do the crown aspects look like? Okay, so first will be the labial side, the front side. How it will be, it is the narrower mesiodistal and central incisors. Okay, incisal edge sloped slightly distal. Okay, incisor edge is slightly sloped towards the distally. Okay, so incisal angle is sharp, so incisal angle will be little bit sharp, distal incisal angle will be little bit rounded. Okay, though labial surface is more convex than central, this is more convex than a central incisors. Okay, so these are the some labial aspects. Okay, so next is lingual aspect. Like in lingual side, how will it look like in lingually it is like more prominent anatomy than central incisors, and well developed cingulum will be there. Marginal ridges you can see, lingual incisors, incisal ridge you can see, common site of dense indenta. Okay, this is the common site for this. Okay, frequent lingual pit in the central of the lingual fossa, there will be a small pit of the lingual pit. Okay, this is how the backside of the tooth look like. Okay, so you can see the marginal ridges, incisal ridge you can see, cingulum you can see, lingual fossa. Okay, this is how the lingual side of the maxillary lateral incisors look like. So coming to the mesial aspect, how the mesial aspect look like. This is a appearance will be how the crown will appear in a triangular shape. Okay, the incisal ridge is centered over the long axis. Okay, long axis. Okay, labial side is more convex, it will be more convex. Okay, so then the cervical line curve incisally, cervical line is curved a little bit incisal, about 3 mm. Okay, this is how the this aspect look like. Okay, this is how the mesial aspect look like. Okay, so you can see the root apex may have a labial curvature, little bit labial curvature, and convex labial outline like highly contour. Okay, mesial contact area at the junction of middle third, incisal third. Okay, you can see incisal ridge on line with the center of the root. Okay, this is how the labial aspect look like. So now coming to the distal aspect, how it will look, similar to the mesial aspect, but distal surface is more convex than mesial surface. Okay, cervical lines show less curvature, like about 2 mm, there it is 3 mm. Okay, so this is how the distal aspect look like. Cervical line on the distal surface curve less, so it is 2.5 mm you can say. Okay, so incisal edge is slightly sloped lingually. Okay, so next is incisal aspect. How do the incisal aspect look like how it is looking. Crown outline is oval or rounded than central incisors. Okay, crown outline will be oval or rounder than central incisors. Okay, labial surface is more convex, labial surface is more convex. Cingulum slightly displaced distally. Here the cingulum is little bit distally side. Okay, this is how the incisal aspect look like. Okay, you can appreciate triangular incisor from with the base of the triangle towards the labial apex, and labial and apex towards the lingual surface. Okay, this is how the triangle form you can see. incisal aspect. So what will be the root morphology here? Here the root will be single conical, okay. Length will be little bit longer than central incisors and thinner, and it will be little bit thinner, okay. So apical third often show distal curvature. Apical third will show little bit distal curvature, okay. Root cross section will be, you can, when you cross section the tooth of this lateral incisors, you can see the root will be oval, narrow, mesiodistally, okay. Mesiodistally it will be oval or narrower, okay. So how do the lingual portion of the root look like? Thicker than labial side, okay. So what is the pulp morphology here? The pulp chamber will be narrower than central incisor. It is more narrower than the central incisors, okay. As I told you, it is oval in shape, okay. Here sometimes two pulp, here the pulp horn will be two, okay. Mesial horn and mesial horn will be the largest one, okay. Root canals will be single canal, okay. Here the round to oval cross section, okay. As I told you, it will be round or oval cross section, okay. This is how it look like. See, you can see the mesial horn and the distal horn, but it is a single rooted tooth, okay. So single pulp will be there, but here the mesial and distal pulp horn you can see, okay. Here you can see the middle may, it will be getting narrow in cervical. It is little bit triangular in shape, okay. Mesiodistally and labiopalatally you can see here, okay. This is how the pulp look in the lateral incisors, okay, of permanent tooth. So what are the variation and anomalies? Like what variation and what anomalies you can see? Defective maxillary central incisors is well known for variation. Here more commonly you can see some other things, okay. Like a peg shape lateral incisors is most common. Dens in denta is also common. Tenon's cusp is also, you can see hypodontia, you can see fusion of the two teeth, you can see palatal grooves, you can see more. This make the tooth clinically important in restorative dentistry and endodontics. Because of these features, tooth clinically, this tooth is very important for restoration of restorative dentistry and endodontics, okay. So this is how the peg shape look like, okay. And here in the second diagram you can see the talons cusp little bit, okay. This is how it look like, okay. So what are the clinical conditions you should check for? Lingual pit and investigations increase the risk of caries and pulpal involvement. Because of the lingual pit there will be more prone to caries, okay. So root curvature may be complicated for the RCT. Sometimes the root curvature might be the complication for RCTs, okay. High aesthetic value frequently involved in cosmetic dentistry. It is the most what do you say, aesthetic value is high due to the cosmetic dentistry, okay. Peg lateral offer treat with the veneers composite build up or core, okay. How, like here you have seen the peg shape now. This how you can treat is like veneers you can put or composite build up you can give, or go for the crown, okay. So what are the eruption, like what age it erupt? Around 8 to 9 years it get erupted, okay. Eruption of completion of root formation, when does this root completely form is 11 years, okay. Average length will be of this tooth is 22 mm, okay. Canal will be single, okay. Curvature distally or straight, sometime it will be distal side or straight it will be. Axis cavity round or oval, round or ovoid, okay. Here, so this is how the pulp look like, okay. Oval or here you have seen a ovoid or round triangle, okay. So in radiograph the lateral incisors look like this, okay. So what will be the conclusion of this video is maxillary lateral incisors is the smallest but crucial anterior tooth with distinctive morphology and high variation, okay. It rounded crown, prominent lingual anatomy and unique anomalies make it important for both aesthetic and dental management, okay. So this is the video of the permanent maxillary lateral incisors. Hope you understood, and this much slide is more than enough to write in your papers. So write it properly, draw enough diagrams if possible for the each aspect is the most important thing you will do while writing the examinations. So it is also one of the most important tooth in the oral cavity, so study it properly, and it is very important when you come in the clinicals for the root canal treatments or something like that. It is the most, you should know the morphology of the tooth before treating that infected tooth. Okay, so I hope you enjoyed this video. If you have liked this video, please do like, share and subscribe my channel. Thank you for watching. We'll come up with new videos every day, so do like, share and comment. Thank you.